Demand on your care. Presentation of illness symptoms in older adults. Metabolic syndrome. Metabolic syndrome is a collective term which refers to a cluster of multiple high-risk factors, including central obesity, high blood pressure, high blood glucose, and high blood lipids. But it is not an individual disease. Although there is no immediate life-threatening condition and obvious symptoms in the early stage, it greatly increases the risk of serious diseases such as heart disease, stroke, and renal failure. A study found that 1/5 of adults in Hong Kong have metabolic syndrome. Many people misbelieve that only middle-aged and old-aged need to pay attention to metabolic syndrome. But in fact, there is an increasing trend towards younger population. How is metabolic syndrome diagnosed? According to the guidelines of the International Diabetes Federation, central obesity is defined as a waist circumference of greater than or equal to 90 centimeters for male and greater than or equal to 80 centimeters for female in Chinese. If you have central obesity and any two or more of the following criteria, you will be defined as having metabolic syndrome. Blood pressure, greater than or equal to 130/85 mmHg or treatment of previously diagnosed hypertension. Fasting blood glucose, greater than or equal to 5.6 millimoles per liter or previously diagnosed type 2 diabetes. High-density lipoprotein cholesterol, HDLC, less than or equal to 1 millimole per liter in male, less than or equal to 1.3 millimoles per liter in female, or specific treatment for this lipid abnormality. Triglycerides, greater than or equal to 1.7 millimoles per liter, or specific treatment for this lipid abnormality. High-density lipoprotein cholesterol is considered good cholesterol, as it helps remove bad cholesterol in the blood, protecting the cardiovascular system and earning the nickname the cleaner of blood vessels. On the other hand, triglycerides are considered bad fats that accumulate within the blood vessel walls. Therefore, a decrease in HDLC levels and an elevation in triglyceride levels can narrow the blood vessel walls, ultimately obstructing blood flow and increasing the risk of cardiovascular diseases. The causes of metabolic syndrome include excessive weight, especially excessive abdominal fat, poor diet, such as consuming excessive salty, sweet, and oily foods while eating less fruits and vegetables, lack of exercise, old age, smoking and excessive alcohol consumption. Insulin resistance, which means the cells in the body become less sensitive and eventually resistant to insulin, causing glucose can no longer be absorbed by the cells but remains in the blood, which leads to high blood glucose. To effectively treat and prevent metabolic syndrome, it is necessary to adopt healthy lifestyle, includes engage in regular physical activity, doing 30 minutes of aerobic exercise daily, such as jogging, swimming, cycling, etc. Try to walk 10,000 steps a day and avoid a sedentary lifestyle. Emphasize a balanced diet. Choose low salt, low sugar, and low fat foods. Consume adequate amounts of high-quality protein, for example eggs, fish, chicken, beans, whole grains, vegetables, and fruits. Minimize processed foods. Control body weight. However, it's important to note that being slightly overweight is beneficial for survival in old age. Avoid body weight loss unless for important medical reasons. Quit smoking and limit alcohol consumption. Undergo regular health checkups. Metabolic syndrome is not solely a disease of older adults. We should start maintaining a healthy lifestyle in young age to reduce the risk of metabolic syndrome and prepare for healthy aging. Please visit our website, Facebook, and YouTube channel for more information on elder care. Before you leave, remember to like and subscribe our channel.